My name is Julia. I am one of the supervisors here at Northern California Retina Vitreous Associates.
Hi, I'm Erica. I'm one of the office managers at NCRVA.
My name is Amr Hayath. I'm the Chief Administrative Officer for NCRVA, and I've been with the organization for 5 years now.
Our front office operations are very busy. We have 6 locations, 7 retina specialists, and a very high call volume.
We found that we were getting about 10,000 phone calls a month, but missing about a third of those because of the number of phone calls we had and just the ability of our front desk staff to answer all of those calls.
Even though we have about 16 front office specialist team to help pick up the phones, it just seemed that it was just not enough.
Introducing Assort has really helped by allowing them more time to complete other tasks. It's definitely brought a lot of satisfaction to our patients and our referring providers. They've been able to get patients scheduled a lot faster.
We were able to quickly see within the first couple of weeks that the phone calls that Assort was answering versus our staff answering really shifted our staff's responsibilities. As we were looking for potential solutions to this pain point of answering phone calls, we first looked at whether or not it would be worth it for us to just hire more people to put on phones. But the challenge with hiring more people is that finding the right candidates, training them, retaining them, and then having to manage when they're out or if they decide to leave, it becomes very costly very quickly. What Assort has allowed us to do is help us leapfrog our timeline of strategic priorities because it's allowed us to free up our staff and their capabilities as well too.
The scheduling of retina patients is complex because of the length of time that the patients need to spend in our office. It can be anywhere between 1.5 to 3 hours for a new patient. Assort has been able to help by scheduling them more efficiently and also making sure that the patients that are coming to us actually have a retinal condition that we're able to help them with.
With these predefined rules that we set, Assort was able to just read the data off of the appointment note and schedule their follow-up appointment or a new appointment based on the appointment type and the last follow-up note that we have. Assort could even determine if an established patient needs to become a new patient based on the last appointment date.
We have a timeline set for each diagnosis depending on the urgency or what it is. So for example, if a patient calls and says, I'm being referred by Dr. So-and-so for a retinal detachment, on our scheduling guidelines, we have that needs to be scheduled within 1 to 2 days. So Assort is able to identify the urgency of that appointment and get the patient in as soon as possible based on our guidelines. So HMO insurances are very complex because of the feature that they have where they have their primary care doctor work as like a gatekeeper, and all the appointments that come to us, we have to have a prior authorization at least started to be able to treat the patient, and Assort has been able to identify these patients with these specific plans and alert us before getting them scheduled. And then as far as the referring physician's office, being able to schedule right away has really improved our relationship with them.
I really appreciate Assort's level and commitment to service. They really are a true partner. The founders, the account manager, everyone that we've interacted with and talked to is really focused on the same thing that we are, which is delivering the best patient care and service. Someone who's constantly thinking of what the next 5 to 10 years is going to look like for our practice and medicine as a whole. I'm really excited about the role of AI and our partnership with Assort and what it will allow us to achieve in the coming future.